Hi, welcome everyone. Thank you for joining us this morning. My name is Crystal Torres, and I want to welcome you all to the Introduction to Community Health Centers and Onboarding Resource for New CHC Staff Session 2 workshop. Before we begin, I would like to start with some housekeeping. This training is now being recorded. A copy will be made available to you after the training via email. And if you are disconnected, please log back in reusing the credentials provided to you post registration or via the Outlook calendar invitation. CCALAC's training center strives to provide a learning environment based on psychological safety to set the necessary context for you to speak your truth as freely as possible. We encourage you to be present, remain respectful and courteous, use the chat responsibly, and give everyone the opportunity to speak. While in the main training space, we encourage camera use and you will remain muted to limit background noise during the presentation. Microphones and cameras can be utilized freely in the breakout room activities that we will host today. And we also strongly encourage folks to update your name on Zoom for acknowledgement by us. And we also hope to have an interactive training and would like to know who is present and also record your attendance for today's participation. During our time together, we would hear material from our presenters followed by a Q&A. And if you have not already done so, find the chat box feature to say hello. This area can be utilized to send questions or comments to our experts or messages to our members of our team who are standing by to support you. We will make every effort to answer your questions, but please note we may call on you if your question is unclear or requires clarification. We advise you to use the hand raise feature located on your Zoom toolbar if you would like to be acknowledged. If for some reason we run out of time, we will make sure to follow up with you via the follow-up email that will be sent after this training, along with the course materials and the recording of today's training. Therefore, we highly encourage you to check out both your inbox and junk mails for any information from the training center regarding today's training. With that being said, we can go ahead and get started. Thank you for joining us again to the Introduction to Community Health Centers and Onboarding Resource for New CHC Staff. Today's presentation is going to be presented by myself, Andres, and Alex. And just so I feel like we should introduce ourselves again. So I'm the project coordinator here at CCALAC, and then we can go on up. Andres, feel free to introduce yourself.
Yeah, hi, good morning, everyone. Again, my name is Andres Sanchez. I use they, he pronouns used interchangeably, and I'm the Workforce Program Manager at CCALAC.
Hi, good morning, everyone. My name is Alexander Gill. I go by Alex, and I am the Assistant Director of Workforce here at CCALAC. Welcome to today's training.
Alrighty, next slide. Alrighty, so today this is going to be our agenda for today's training. As you notice, we already went over housekeeping. Then we'll do a little icebreaker question just to get started and kind of see what you guys learned from last training. And then we're reviewing the agenda, and then we're going to go over burnout and burnout prevention, as well as have a breakout room activity in the middle, and then have a mini group debrief. And after that, we'll have a polling question, and then we'll have a discussion discussing the importance of customer service and the patient's community health center serve. We're going to end it with really sharing a lot of the CCALAC resources that we have, and followed by a Q&A. So we have a very robust agenda today. Next slide. Alrighty, so icebreaker question. So what did you remember learning from last session? So feel free to use your phones to get the QR code. I would also share it right now shortly on the chat. So, and I would read out, I'm going to read out what's been shared. So it's okay if you guys don't see what's coming up, but yeah, feel free to participate in that icebreaker question. Let folks type in their responses. What do you remember learning from last session? Alrighty, I got a few. So a lot of folks are writing history of community health centers, the importance and history of community health centers in healthcare, history of community health centers. The JEDI program came from the 2020 protest. Yes, the CCALAC did conduct their JEDI work after the 2020 protest. I remember CCALAC was founded during the civil rights movement. Yes, where funding comes from, the social drivers of health and JEDI Foundation. Awesome. Alrighty, it sounds like folks do remember last session. Different needs for different areas mapped out. Yes. Thank you. So thank you for your responses. Feel free to keep responding as we go as we continue. So that's going to be open for everyone else who are just joining in. But again, thank you so much. It sounds like a lot of folks do remember everything we discussed from last session. Next slide. With that being said, I'm going to pass it over to Alex.
Thank you, Crystal. All right, so we're going to start off today's presentation talking a little bit about burnout and burnout prevention. Next slide. So first of all, what is burnout? So burnout is a state of physical and emotional exhaustion. It can occur when you experience long-term stress in your job or when you have worked in a physically or emotionally draining role for a long time, which of course, healthcare is a very physical and emotional draining type of career. Burnout is marked by emotional exhaustion, depersonalization, and a lack of sense of personal accomplishment. Sometimes folks might get burnout confused with stress. It can be very similar. However, stress is often short-term, whereas burnout takes place over a long period of time. Stress usually will change over time. It will either lessen or it will disappear over time, whereas burnout can increase and lead to many other factors, which we will talk about during this presentation. Next slide. So why are we talking about burnout? So in 2020, the pandemic really hit us hard. And by us, I mean healthcare. So it really caused a lot of clinical and non-clinical staff to become burned out. And they continue to be burned out to this day. And it's become such a challenge for healthcare organizations, meaning clinics, health centers, hospitals, everyone, that it's really a priority for a lot of individuals, including the US Surgeon General. So this quote here is directly from their website, and I'll take a second to read it. It says, "The realities of our healthcare system are driving many healthcare workers to burnout. They are at an increased risk for mental health challenges and choosing to leave the healthcare workforce early. They work in a distressing environment that strains their physical, emotional, and psychological well-being. This will make it harder for patients to get care when they need it." So due to the increase in burnout, like this quote says, we're having challenges in workforce. Individuals are, one, no longer considering pursuing a career in healthcare. Two, they are no longer pursuing a career in community healthcare. So they're choosing to go to a different type of setting, either private setting or hospital setting. And three, they're having, health centers are having trouble recruiting and retaining staff overall. Overall, it's taking an average of 3 to 6 months to recruit a person, sometimes even longer. And also, staff are leaving. They're leaving health centers, going to a different health center, and kind of bouncing around, trying to find a better working environment. Next slide. So why is discussing burnout important, and why are we talking about it here during this presentation? So it's very important for individuals that might be new to healthcare to really learn about burnout early on, so that they learn how to identify signs of burnout and to help prevent it early. It's also helps them increase compassion and empathy. And then also reconnects them with joy and purpose of their work, and it improves their physical and mental health. Overall, as a health center, it's important to discuss about burnout because it decreases staff turnover. It reduces costs associated with recruitment and retention and replacing individuals, and it increases patient satisfaction. There's also less errors. It improves the work environment, and it also causes less need for disciplinary actions. Next slide. Next slide. There we go. Thank you. So some causes of burnout. And there's multiple causes of burnout. These are just some of the top causes of burnout. So the first one is lack of autonomy. You might be in a role that doesn't have, where you don't have much control over your work, or where you might have a very high workload that makes you feel like you never have enough time to finish tasks or projects. You might be new to a position, or your position might be new, which means there are unclear goals or unclear job expectations. It might be that the organizational culture of your health center is a little dysfunctional, or your team might be a little dysfunctional and needs some work. This can also be having unreasonable expectations, especially for those providers, asking them to see a high number of patients that can be very stressing for them. Like I mentioned, an excessive workload. Also, having little or no support from your supervisor or organization is also one of the leading causes of burnout. Usually, when the health center is doing exit interviews, one of the main causes, I would say probably one of the top 3 causes why somebody says they're leaving the organization or the health center is because of their supervisor. Another cause of burnout is lacking recognition for your work. So not having a recognition program or a praise program, or anywhere where you are recognized for the efforts and work that you do for your health center. This can either be verbally or through formal recognition like certificates and things like that. And then lastly, having monotonous or low stimulating work. So if you find yourself in a position where you are doing the same thing day after day, hour after hour, it can feel very depressing and sad. So finding ways to really find more joy in your work and create more autonomy would really help with that. And there's actually a burnout self-assessment which you can take. So when we share this presentation, there's a link here. I highly encourage you to take this assessment. It takes about 5 to 7 minutes to complete, and it will let you know if you have signs of burnout. Next slide. So symptoms of burnout. So the first one is having a negative and critical attitude at work. If you're burned out, you're usually going to feel very negative about work. You're not going to want to go into work. You're going to want to leave early. You're going to want to make excuses for being there. You're going to maybe make or give reasons why you need to leave early or just get out of there. You might have also very low energy and very interest in your work or projects. This can also lead to having trouble sleeping, using more of your time off, having feelings of emptiness, experiencing also physical complaints like headaches, illness, or backaches, being easily irritated by team members or patients. There might be difficult situations where before you would just brush it off and say, oh, that's just a difficult patient. But now that you're burned out, you might be really stressed out or get really upset and might blow up on someone. Next, you might have thoughts that your work doesn't have meaning or make a difference. You might start pulling away emotionally from your colleagues or the patients. You might feel that your work and contributions go unrecognized. You might also start blaming others for your mistakes. Rather than taking accountability, you might start saying, oh no, that wasn't my fault. That was so-and-so's fault. They didn't do X, Y, and Z. Whereas before you might take accountability. And most importantly, one of the biggest symptoms of burnout is is you start thinking about quitting or changing roles. Next slide. So consequences of burnout. So the first consequence is that patients get affected. Their patient satisfaction decreases, they have longer wait times, and you'll notice an increase in no-show rates. Also, your productivity can decrease drastically. Whereas before you might be able to do 10, 12 things in a day, you'll notice that your productivity starts slowing down. You start moving much slower, and you start wanting to work at the previous speed that you had before. Also, your creativity can be affected. Whereas before you might volunteer to participate in something, or you might take initiative for certain opportunities, you might have interest in those, and you might stop yourself from moving forward in those kinds of opportunities. Again, you might find excuses to miss work or take days off. And of course, burnout can spill over into your personal life. It can start affecting your relationships with friends and family. Next slide, please. So we talked a lot about what burnout is, consequences, and all that. Now we're going to step more into addressing burnout. So to address burnout, we have to look at the different levels where you can address burnout. Of course, there's the individual level, meaning yourself, which we will talk about in the next couple of slides. But there's also the microsystem, meaning the actual health center site itself, the department you belong to, or your team that you belong to. So within the microsystem, there are a few things you can do. One, you can look at changing workflows. You might do like some PDSAs or make some changes to how you work on your projects to see if there's more efficiency. You might do more check-ins and huddles. You might do something like retreats or trainings within your department or your team. These are just some ways to address burnout within the microsystem. At the mesosystem, meaning the organization-wide, meaning the health center as a whole, meaning all of its sites, some things that can be done is the leadership can model self-care, right? I know some of us might have leadership that are always working, right? Working around the clock, sending emails at 10, 11, 12, 1 a.m. Well, when they're not modeling self-care, it can make others also begin to not model self-care. So it's very important when addressing burnout that leadership really models that self-care for others. Next is the organization itself can give explicit permission for self-care during work hours. And this, of course, creates a culture of wellness and encourages others to step away from their computer for a little bit, to, of course, take their meal and lunch breaks, and to really practice self-care within the workday. Another thing that the health center overall can do is create wellness programs and encourage use of employee assistance programs. I know sometimes, these get mentioned only once a year when, Human Resources does their, annual, review of benefits and all that. But it's very, very important that organization-wide, we encourage employees to make use of their benefits, including any employee assistance programs. Next is having trainings and retreats. It's very important that as a whole organization that health centers meet with their staff, communicates information to their staff, and get together at least a couple times a year, either maybe within departments or organization-wide, to really create that culture that says we care about you. And then at the large macro level system, meaning the healthcare system overall, we can do policy and regulation changes. We can advocate with our elected officials for them to make changes that would help decrease burnout. We can do research, and we can make improvements to technology. We all know that sometimes our electronic health record system and medical record systems are not always great. So finding improvements in those types of technologies would really help with addressing and reducing burnout. Next slide, please. Now, as an individual, here are some things that you can do to prevent and reduce burnout. Like I mentioned previously, take your meal and lunch breaks. These are your right for you to have. So I highly, highly encourage you to always take your lunch and meal period and meal breaks, and specifically away from your desk, if possible. I know sometimes that might not be possible, but I highly encourage you to do so. Next is take your sick, personal, and vacation days. Don't let those accrue. Make sure you take those. Again, that is your right to utilize those. Next is get organized. Prioritize your tasks and projects. Stop multitasking. Allow yourself to focus on one project or task at a time. Make sure you manage your time and calendar and learn to say no. That's very, very important. I think sometimes we want to be people pleasers and it's difficult to say no to additional work or projects. So it's very important to learn to say no, but of course, having a reason to say no, saying you don't have time for that at this time, that your workload is too high, but learning to say no is very important. Also, delegating responsibilities is also very important. Making sure you're sharing the workload with others, and trying not to be the expert is very, very important, especially when working in a team. When working in a team, if you are the expert of that team, you might find that everyone's going to come to you and you're going to be the sole resource and the content expert, which is great, but then that can lead to burnout because everyone's coming to you, which can lead to increased workload. And of course, make sure that you're talking to your supervisor about your workload. I would say, at least a couple times a year, but if not, at least during your performance evaluations, you should be talking to your supervisor about workload. Also, make sure you think about your physical and mental state, make time to meditate, go for walks, step away from the computer screen. Of course, get enough exercise and sleep, learn to manage stress, connect with others socially, make sure that you have a social network within work and also with outside of work. So this can be peers, supervisors, colleagues, and of course, seeking professional help as needed. It's also very important to find meaning outside of work with hobbies and other interests. It's very important that we have things that really excite us other than our career. This can be family, friends, hobbies, clubs, sports, TV shows, all kinds of things. And lastly, make sure to make time to embrace joy and make time to reflect, celebrate your work and personal accomplishments. Next slide. So also when talking about ways to prevent and address burnout, we have to talk about resiliency and being resilient. So resiliency is a process and outcome of successfully adapting to difficult or challenging life experiences, especially through mental, emotional, and behavioral flexibility and adjustments to external and internal demands. Somebody who has really good personal resilience has self-awareness, they have determination, they have vision, they have self-confidence, they have organization, they are able to problem solve, they have social interactions, and they have relationships with others. Next slide. So when really talking about having good resiliency and being able to address burnout, it really is about two main factors. One, having personal control over your responses to others, which is of course related to interaction and relationships. So, sometimes burnout causes a lot of stress, and we then take the stress and then sometimes we might flip out on others. We might say things we don't mean, things like that. So taking personal control over your responses to people in challenging times can really help with your resiliency. and help with your burnout. Another thing is personal control over responses to events. Sometimes there are things that are out of our control, things that we cannot have any say in, that we have no control in. So in those instances, being able to problem solve and get organized for those responses would really help with your resiliency and also with your ability to reduce and prevent burnout. Next slide. So there are many, many, many ways to build resiliency, but I'm going to give you just what I consider the top 10 ways. So the first one is find your purpose. So sometimes there's going to be, well, not sometimes, all the time, we're going to have challenges, right? Either in work or in life. So after that challenge, make sure you find a purpose. Make sure you think about why that happened, and not become discouraged, and really find a purpose from that. For example, if you lose a family member or something like that, and you are really stressed out, you can begin to maybe find a purpose in spirituality. You might then become more mindful. You might that might lead to finding interest in hobbies or things like that. Second, believe in yourself. Have confidence in your ability to cope with the stresses of life. 3, I think I mentioned this before, develop a social network. Find supportive people around you to act as a protective factor during times of crisis. 4, embrace change. I think this is very, very important. Be more flexible and adaptable. Sometimes it's much more easier to let things go and go with the flow than to react and have a negative viewpoint. 5, be optimistic. Practice positive thinking. Practice looking at the glass half full instead of half empty. Nurture yourself. Make sure you're covering the basics for yourself, such as eating, sleeping, exercise, being mindful, meditating, things of that nature. 7, develop problem-solving skills. 8, establish goals, personal and professional. I would say, at the very least, make sure that you are establishing new goals for yourself at least once a year. And make sure that you are reviewing these goals to see if you are achieving them and what your progress is towards achieving those goals. 9, take action. Talk to your supervisor. Don't wait for challenges to go away. Make sure that you are talking to your supervisor, to your colleagues, to others. Make sure you are asking them, what are you doing to help with your stress? Or I noticed that you do X, Y, and Z. Can you tell me a little bit more about what you do to help with this? Or how do you project manage? It's very important to talk to others and not wait until things worsen. And lastly, commit to building skills over time. Sometimes, especially when we are given new projects, we want to learn things right away. We want to be perfectionists. We want to learn things quickly. Sometimes that's possible. Other times it's not possible. So it's really important to remind yourself that we're not machines, that we can only absorb and do so much. And it's very important that we build skills over time, and that we create a culture of learning for ourselves. Next slide. So now we are going to do an activity. We are going to break out into breakout rooms, and we are going to be, let's see, we have, I believe, 26 people in here. So let's do groups of 4. If we can do groups of 4, Aisha, that would be great. We're going to break off into breakout rooms, and we're going to discuss I want you to discuss these 3 questions So the first one, what burnout prevention tools do you have in place at your health center? For example, does your health center have a wellness program? Do they have a a meditation room? Or have you had any training on burnout prevention before? Are there any new burnout prevention tools that you've learned and you plan to adopt? And then also, are there any burnout prevention tools that were not discussed today that you wish to share? So we're gonna break out into breakout rooms for, let's do 8 minutes. And then we'll come back and then we will share out to see what you all discussed. So the questions have been shared in the chat box. Please make sure you copy them so that you can share with your breakout room. Aisha, please feel free to send everyone into breakouts. Back to the main session. Welcome back. I think we almost have everyone, not yet.
There's good conversations in group 1.
All right, I think everyone's back. Yeah, I think we're all back. All right, I hope you all enjoyed that time to discuss with others. We're gonna do a little bit of a debrief. So let's start off with room 1, which was Christina, Gerson, Janet, and Jordan. Can one of you all share what your group talked about?
Hi, good morning. I'm Gerson Salazar. So we kind of talked about how every group, every clinic kind of defines burnout differently. I think one of the participants was saying that in their clinic, they don't focus on burnout as a label, they focus on wellness rather than, right? And so I was discussing how it's important to not necessarily avoid labels, but because they are necessary to definition. But definitely coming from a place of strengths-based perspective and a positive perspective. And again, still, being able to label things for what they truly are, right? Burnout does exist. It is a real thing. So just kind of avoiding the word doesn't necessarily make it any better. And then we talked about how, like, at least at Achievable, which is the clinic that I work at, I'm fairly new, and one of my colleagues is on there as well. And we haven't really discussed burnout and we haven't really touched on it. And it's like, that's one of the things that occurs in many organizations where it's kind of left towards the back burner. It isn't necessarily brought up until it becomes critical. So everybody else was sharing how their clinic is trying to engage their staff and trying to put things in place. But there's also funding issues. There's, all these other kind of intermediary things that occur that kind of prevent that wellness from being discussed and from being rolled out.
Thank you. Very, very valid points. I know definitely funding is always an issue. Time is always an issue. But I really like how you said that, sometimes it's addressed too late. It's very, very important to address burnout early on and see the early signs and symptoms. How about room 2, which was Angela, Nicole, Sebastian, and Sanampreet? Sorry if I mispronounced it. Could someone from that room share out what their group talked about?
Hi, everyone. We had a really good discussion and just kind of shared some tips and things that we are doing. For example, I love the idea someone shared that I don't know how to really explain it, but kind of in the words of they kind of bring some, like a potluck in a way. They bring food to share with a colleague. They have a really spacious break room lounge where folks are just kind of bringing foods to share out with everybody, because who doesn't like to snack throughout their day? Another idea that I actually brought up was just people calling out sick. And if that was a trend that they're seeing at their health centers, just a lot more call outs because that's fairly new to me in this world. So yeah, those were just some really cool just topics we talked about. If anyone else wants to chime in, please do so.
Awesome, thank you. How about someone from room 3, Martha, Rebecca? Or someone from room 4?
We kind of talked about, we didn't really address burnout too much either, specifically, whether we're experiencing it in our workplaces or not. But I did share that at our health center, typically there's 2 10-minute breaks a day, one in the morning, one in the afternoon. So what we started doing as an organization, rather than because I think Rebecca mentioned that her organization kind of struggles with taking that 10-minute break. So then they started to designate a break time for individuals. Well, as an organization at our health center, we once a month, we've been having one of our leads lead a 10-minute walk at the morning break, and then in the afternoon break. And because our health centers are nearby within a block from each other, we meet at a designated corner, take a brisk 10-minute walk. So then it gets us to engage with our leadership members, and then again, get people away from their desks, taking that breather, taking a walk, which also is implementing wellness as well.
That's awesome. I love that. That hits a lot of points, physical activity, time with leadership, time away from screens. That's awesome that you guys are able to implement and do that.
Yeah, and it's become really popular. Everyone seems to really enjoy it. So we're keeping it going.
Awesome. Thank you, Martha.
You're welcome.
All right. So we're going to move on to the next section of our presentation. So before that, I think we have a poll, but I'm going to pass it on to Andres, who's going to talk about customer service.
Yeah, we can start with the poll and then we'll pass it on to Andres. Thank you everyone for participating in that breakout activity and sharing your thoughts about it in the discussions within your breakout room. So right now we want to poll folks on, have you been trained in customer service? And I'm going to send the Mentimeter again, so feel free to participate in that poll or use the QR code. We just want to see how many folks have been trained in customer service. Alrighty, I'm getting a lot of yeses, a few no's, and one I do not remember. Thank you for your honesty. So most of you, it seems like, have had some type of customer service training, the majority of you, but there are a few no's and a couple of I do not remember. So I appreciate your honesty, and for the folks who said no or the I do not remember, well, right now we're going to have a quick customer service training by our amazing colleague Andres. So I'm going to pass it over to Andres now.
Awesome. Thank you, Crystal. So yeah, we're going to talk a little bit about the importance of customer service and what does that mean for the patients that you serve, and then also for your colleagues, right? For the interactions, for the structure of the organization. So we're going to move on to the next slide. And really, when we think about customer service, it's really embedded into the entire organization, it's not just about people interaction, right? It's built into the structure of the organization. So when we think about the structure, we think about like the rules, the policies, all of the things that make the community health center function, right? When we think about the process, now we're thinking about like roles, right? Expectations as to what your roles are. And then when we think about the people, those are the individual interactions, and then also thinking about the patients that you're serving. And all of these three things make up the culture of an organization, right? And it could vary depending on, how your organization is structured, what different processes need to take place, depending on your roles and things like that. And then also the types of communities and patients that you serve as well make a difference on how that culture really develops over time. And then also, the positive outcomes that come from all of this. So we're all in our own roles responsible for customer service, but also following the rules, regulations, right, of your organization. And then also, what is your role within the community health center as well. So thinking a little bit about that. So a little bit of reflection there. And we have that as a foundation for the entire organization, right? That's what makes everything function. We're going to move on to the next slide. So why is customer service important? We talk about serving patients that are in under-resourced communities. And so we get a greater adherence to medical advice. So when folks are coming in for care, they're receiving the best possible care that they can get coming out of every interaction that they have with every person that they interact with at that medical appointment, right? Also, we get fewer complaints from folks, right? So the more structured, the more we are thinking about the comfortability of that patient, the less complaints we're gonna get, right? The fewer malpractice claims that also happen, right? So this, if you're not following the rules, regulations, policies of your clinic, or you're offering things to a patient that you are not able to deliver, right? This could lead to, malpractice claims. This could lead to, legal issues for your health center. And then also the improvement of patient health, which is really what we're all there for, right? To support is to improve that patient's health overall. And so the customer service really leads to improved outcomes for patient health. And that's just, over time, there's been different research that has been done that folks are more adherent, right, to coming to their medical appointments, or more adhering to their medication, and they're able to follow through on the different recommendations that their providers make when they have a good relationship with the staff that they're having interactions with. So, just kind of think about some of those things and how that relates to the roles that you have in your individual health centers. We're going to move on to the next slide. So other reasons why customer service is important or improves patient care or patient experiences, right? The need for clients to continue coming back for care. And so clients also need medical homes, right? The majority of your health centers are located in small communities, right? And so these are essentially patients' medical homes, meaning this is where they come for their care and other services that they might need, like housing resources, like, addressing any food insecurities. So all of these different things really are an important part of why customer service is important for the overall care of a patient, right? Primary care is a central piece in the expanded healthcare system. So we have to think about, these folks are coming in for that primary care, are coming in to be able to manage, whatever it is that their health concerns and anything else that they might be in need of. Clients have additional coverage and other choice of providers, right? So they're choosing to come to your clinic, right? They can go anywhere else for care, but they're choosing to come in there. And so it's really important for us to, think about how we're treating each person that comes through the door and how we want them to come back the next time. Also the demand for, faster and better service. And so, I've worked in healthcare in a clinic setting before, in a healthcare setting before. And so it's a very fast-paced environment. And so folks are looking for that, right, you're coming in and out, you're not waiting there for hours. And sometimes that is the reality of it, right? There are a lot of folks that are coming in. So how do we improve those processes? The other thing is organizations with great service attract and retain more clients. And again, this is all based on different research that has been done over time. And if you think about it for yourself, right, when you go to get, any kind of service anywhere, right, you go get your oil changed, you go to the hairdresser, you go to a restaurant, right, you expect great service from every person that you interact with at that place. You expect speedy service, you expect great communication, right? So think about even your own expectations when it comes to customer service when you go get services in any place, right? So similarly, this is what patients look for as well. We're going to move on to the next slide. So patients overall want a clinical team who are confident, right? That know what they're doing, that have expertise around, whether it's a specific health issue, right? They want folks who are empathetic, who are going to be there to listen, understand, work with them through all of the challenges that they're going through in terms of their health. They're humane, and also personable. I think it's really important to build personal relationships with folks that come through your clinic, because that also builds a rapport, and they're more likely to return back for their next medical appointment, right? As challenging as these appointments may be for folks, they're more likely to want to engage and because they enjoy those interactions with folks that come to your clinic. Also, folks that are forthright, that are respectful, right? We want to make sure that every person that comes through the doors is treated with respect, dignity, and is thorough in terms of, what they're there in terms of their appointment. There are some folks, there's a lot of medical mistrust amongst the communities that you all work in. And so, being thorough, explaining why a certain procedure needs to be done, explaining, why, they need to get, different testing, or they need additional appointments to follow up, and walking them through every step of the way really makes a difference in their understanding, not only of their own health, but also in their understanding of the process to get to where they want to be in terms of their goals around their health. So it's really important to be thorough, right? And explain all of the different things that they're going to be going through at every appointment. We'll move on to the next slide. Right. They get, patients, it's important for patients to understand, right, that they get the care that they need. They're treated as a person. So this is kind of a continuation of the last slide. They're treated as a person, not as a diagnosis, right? We try to stay away. One of the things that we've worked on, I mentioned some of our JEDI work, is to kind of step away from, saying someone's diabetic, right? Or someone has, right? It's patient-centered, it's person-centered, meaning instead of saying, the person is diabetic, it's a person that has diabetes, or a person managing their diabetes, right? So really thinking about how we're centering the patient around the health needs that they have, right? We want to empower patients as well, right? Not surrender to their condition or to the challenges around their health, but really empowering them to take control over, what they can do with the resources that they have that are available either at their clinic or the support that they also have at home, right? They want there's really it's important to be able to promote peace of mind, that they're being taken care of, to have their approaches understood and incorporated. So part of the drive of community health is that it's not just like a system where it's an all kind of situation fitting every person, but more of like taking that individual situation and really working with the patient to be able to address those things. So it's a collaboration more than it is, provider just recommending all of these different things. It's like you have to take a look at the patient as a whole and really considering their support systems, their access to different resources that they need in order for them to take care of their health. I used to work with a lot of homeless individuals or unhoused individuals. And so we often asked them if they had somewhere to store their medication, right? And sometimes as we're going through the day-to-day, we don't think about some of those things. And so, really think about, what your patients may be struggling with, and really thinking about different approaches and support for them. Again, the long-term meaningful relationship, how you build those relationships with folks are really gonna determine whether they adhere to their medical care and they return back for any future appointments. We wanna lead with with compassion and respect. We'll move on to the next slide. The other thing, Alex just talked about burnout, right? And there's this little cartoon at the bottom. It says, on Mondays, we deliver fresh personnel, and on Fridays, we pick up the empties. One of the things about, the work that you all do in the community health centers and the number of folks that you have to see throughout the day can be draining. And so if you're not in a place where you are, you're mentally there to really serve the patient, it's really going to show, and that's going to affect, right, the type of customer service that you're providing that day to the patient. So really determining, right, am I ready for this day? How do you reset? How do you leave, things that you have going on, once you step into that community health center, what type of day are you going to have? Right. And I think asking yourself that question on a daily basis, like what type of day am I going to have today, right, is really important for the service of the patients that you're there to support. Next slide. Compassion is a desired attribute for healthcare workers. Healthcare has ever increasing demands, right? We do want better outcomes. There are often like new players, meaning, new staff coming in. There's, we've had during the pandemic, a large turnover of staff in all of the health centers. And so really thinking about, as new folks come in, how are they adjusting to the culture of your organization? Also, there's this demand for increased productivity, right? And we have to acknowledge that in order for the health centers to stay afloat, right, this productivity needs to happen. And so, we need to think about the processes and then the structure and how all of that is also supporting, right, the flow of patients, supporting the care of staff, and then advanced uses of technology, right? The pandemic kind of shifted into this more virtual way that folks are actually being seen in the clinics, right? Telehealth was kind of a thing already, but then it's increased over, post-pandemic. And so we have to adapt to a lot of these different things. How are we serving, patients that we can't physically see in the clinic and still be able to provide, the care that they need, and then also be able to build rapport over a video call, right? Like, so some of these things have kind of meshed into together. Also new partnerships and processes, right? As we've shifted into, this is a new era for us. We've never experienced this. And so we've had to adapt in so many different ways. We've had to build partnerships. We've had to really reach out and look for different ways to keep folks engaged in their care. We're going to go on to the next slide. And I'm only going to touch on this very quickly because Alex already covered stress and burnout. But what I want to say about this slide is really thinking about for yourself, again, that question that I asked earlier, what type of day am I going to have today when I walk through these doors, right? And really thinking about, am I ready to be at work today? Sometimes we do need to take that time off to be able to reset for ourselves. And there is that difference between what stress feels like and what burnout feels like. And so I think you need to, figure out for yourself and determine for yourself in a almost daily assessment or weekly assessment, however it is that you'd like to think about that on where you are and determine whether, right, you're the right person to interact with that patient that day, or if it's just the right day to go into work in general. And those are hard, hard decisions to make, right? As we all have our own responsibilities, at home and other things that we also take care of for ourselves. So, just wanted to touch on that. We're going to go on to the next slide. So lastly, I just want to end with this, really the 12 principles of customer service, which are, the first one is patients want a great experience. Again, thinking about for yourselves, when you walk into different spaces, you want to have a great experience from beginning to end. The same thing with the patients that walk through your door. And I say this often in customer service trainings, is that we're no different than the patients that walk through our doors. We have similar, expectations. We have similar challenges, may vary, right? But there are different things that are similar to the patients that we serve. We are all accountable for great service. So every person in every role, even from, the security person, right, at the front of the clinic, if you have one, right, to the front desk person, to the MA, to the case manager, to the therapist. Everybody has a role to play in that patient's in that patient's care, and so we're all accountable for that service. Customer service starts with us, right? If we're not doing well and we're not able to provide that care at that time we're not in a place where we can provide empathy, right, or understanding at that moment in time because we're going through what we're going through, then we need to determine who can we hand that person off to so that they really get the care that they need at that moment in time, right? Staff will serve the client to the degree that we are served by the health center. Again, going back to, Alex talking about the burnout and how we address some of these things. Does your health center have, a wellness program? Do they talk about it? How will you go back to your community health center and discuss some of these different things that you might need in order to stay functional and in order for you to to provide good service? And so if your health center does not have these things in place, support systems in place, these are also things to go back and discuss, right? These are the things that you also need in order for your patients to also be well. Attention to detail is key to success. And again, when I talked a little bit about, you have your workflows and you have, your chats that you have, your huddles that you have at the beginning of the day or at the end of the day, however they happen for you, are you reviewing patients' charts? Are you right before they come in? Do you know why they came in the last time? Like those little details really make a difference for folks, right? If you remember their name, right? All of these different things really are key to succeeding in great customer service, right? Bad systems stop good people. So again, if you see challenges within your workflows, within the processes of your organization, or things that are even structural, how do you talk to your supervisors or even folks that are the decision makers on making those changes for things to be better in your space, right? This is also a point of advocacy, an opportunity for advocacy for yourselves as well. Systems must serve the customer, right? So again, thinking about the structural piece, the processes, all of that stuff are important. And if there's something lacking, then that means that patient is not going to get the care they need. The other thing is a complaining customer is your best friend. There's, we can do all of the things, and sometimes there's still going to be that one person or a couple people that are not going to be content, right, with a service that you're providing, and that's just life. But you can take the things that they do tell you, right, that are not going well for them or that they're not agreeing with, and you can take that to your supervisor. You can take that to folks that are decision makers on how do we better address these different things. You must manage your reputation, right? It's really important. All of the clinics have been providing, depending on what clinic or community health center you're at, been around for a lot of years, right? Some of the health centers are newer, but really you're building a reputation as you're providing this care to patients, right? As folks are returning, they're going to go out and talk about the care that they get, right? And if they're not getting the care that they need, they're more likely to share out with folks. So think about that for yourselves too. Like if you have a bad experience, you're more likely to share it than when you have a good experience. I use customer satisfaction surveys to resolve problems. So most of your health centers should have some type of like quality improvement, a process where there are customer satisfaction surveys that go out. These are opportunities to get feedback from folks and find out if they are, satisfied with the services that they're being provided with. Leaders are coaches, right? So every person that is part of the health center is a leader, no matter your role, right? You're taking the lead in different ways, right? So we're all leaders. And that also means that you're in turn coaches to the folks that come in that are newer at your health center. And so, really building that culture, again, going back to that first diagram, right? The people also make the culture of the organization as well, right? So if we hoard information instead of sharing it out to folks that are coming in, that are new, might be their first job, right? Like, how are we preventing them from growing as well? So we got to think about that. And then, also Alex mentioned this is celebrating success. When things are going well, it's important to celebrate as a team and really consider, all of the things that you've done. It's really important to have those moments of celebration of like, yes, we did something great. And it doesn't have to be like a whole team. It might just be you and another colleague that helped out a patient and it worked, in the direction you wanted it to go in. And you celebrate that moment. And it's the little things that really keep folks going in this process. So this is the last slide to share for customer service. So I want to take a pause here for any questions or comments. Okay. I don't see anything. So I'll hand it back over to Crystal.
All righty. Thank you so much, Andres. I think we're going to start with, we're going to go over all of our CCALAC resources, but I believe we're going to start with the CCALAC website. So I'll hand it over to Alex.
Thank you, Crystal.
Mhm.
So we have a variety of resources available, and we want to make sure that everyone knows about them. And pretty much they're all available via our website. So I am sharing my screen, I'm sharing our website, and I'm gonna walk you through where to access these. Can everyone see my screen? Awesome. So our website is ccalac.org. When you get to the main page, this is our main page. One of the first things I encourage you to do, if you already have not done so, is to create a login for our website. And you do that by here in the top right where it says sign in. You click here. If you have already created a login, your username will be your email address. If you have forgotten your password, you can put lost your password. If you're a first-time user, you can click on create an account, and then it will ask you a few questions like your name and so forth, and email, and you can create an account. It's very important that you create an account so you have access to some of the material that is private for our member health centers only. So there's some information that is public, but there's also a lot of information that's private to our members only, and you will need a login for that. So one of the first things I encourage you to do is to create a sign in. Next, one of the things that you also can do on our website is is find the clinic or health center, which is the button here in the top right. If you click this button, it will show you where all of CCALAC's member health centers have clinic sites. And as you can see, they're all over LA County. If you type in a keyword like Long Beach, zip code, and a distance, it will give you, will show you what health centers are away from that. So let's type in, for example, let's do Downey. Let's see, 10 miles from Downey. Let's do a search. And it will tell me the health centers that are located within 10 miles of Downey. And then we have JWCH, Family Healthcare Centers, and Altamed. So that's a great resource to know. Also, another great resource to know is our training center, which is right here in the middle. You click on Training Center, and it will take you to the Training Center page. This will show you the trainings that are currently available through our virtual training center. For example, here you can see here during the month of May, we have the annual ECW User Collaborative Training, PAP findings with capital link, trainings for June, trainings for September. So if you ever are looking to see what training opportunities are available, you can see it here. And our website is going through some changes. So in the next couple of months, you will see that our pages have or will be updated and might look slightly different. Also here, you can click on View On-Site Trainings, and you can see what trainings can be conducted by the training center team in your health center. And Tracy, whose contact information is right here, is Assistant Director of Training and Equity. You can contact her if you are looking to do a specific training at your health center. You can also subscribe by clicking on Subscribe Now to get updates on when new trainings are released. So it will send you an email newsletter telling you these are the new trainings that are coming. Next, you can visit our job board by clicking on Job Board. Here you can see all of the different positions that are open at CCALAC's member health centers. So a lot of our health centers, I would say about 50% of them or 60% of them submit their job openings to our job board. And so they post them here. So here you can see what other health centers are hiring for. You can see location, hourly wage or salary, what languages they require, whether they're full-time or part-time. If you click here, it'll take you to the job description. And then you can click on how to apply, and it'll tell you the link or where to send your resume to. This is open to the public, and it's updated daily with new jobs. So you can click on here and send this to friends, colleagues, family that might be looking for employment in a health center. And there is clinical and non-clinical jobs. So everything from doctors and nurses, medical assistants, to coordinators, care coordinators, facilities, events managers, everything you could think of is listed on here. And then here on our job board, you can also subscribe to get a job board newsletter where you get updates on new jobs that are posted. You can also submit your resume. So if you or someone else is looking for employment or the next opportunity, you can submit your resume. It will be active on our resume bank for 60 days. And then we will circulate it to those health centers that are interested in hiring. And if they are matched with you, they will contact you for an interview. And lastly, I also want to mention our events page. Here you can see different trainings that are going on, different roundtables that are meeting that specific day. CCALAC has a variety of different roundtables. We have a roundtable on health education, on policy, on human resources, quality improvement. The list goes on and on. These roundtables meet either monthly or every other month. And so when those occur, they are listed in our events calendar. You can also see what CCALAC is doing for National Health Center Week, our annual symposium, our annual emergency management symposium, our health IT summit, our policy cafe, then of course our overall calendar. On the main page, you can see, kind of our different departments per se. We have policy and advocacy, finance and operations, clinical and quality improvements, workforce, emergency management, HIT, and pharmacy. So if you're ever looking for resources, I encourage you to click on these specific ones. You can also go up here to where it says resources, and it will take you to resources. I encourage you also to sign up for the Friday update, which of course you need a login for that. It's kind of a weekly newsletter that summarizes everything that's going on and has a lot of resources and events. And that is the CCALAC website. I encourage you all to, again, make a login, sign in, and take some time to explore our page. And of course, shoot us an email if you have any questions. I'm going to pass it over to Crystal.
Alrighty, everyone. Thank you so much, Alex, for sharing our CCALAC website. So we have a lot of robust resources on the website. So I highly encourage you to kind of check it out and see what you can find. And again, if you have any questions, feel free to contact either one of us or any of the contacts that are listed on the website. With that being said, I'm going to go over our workbook that we created for this particular training. So this is the workbook, and I'm just going to highlight the things that that's on the workbook for you to look at and kind of check out and learn more about. So the workbook highlights basically the onboarding training, as well as who we are, and as well as this page, this table of context kind of gives you an overview of what is in this workbook. So there's information about CCALAC and all of its resources, as well as activities for you to do on your own time. And I highly encourage you to do those activities and also use it as a way to kind of reflect, as a reflection moment on why you're in the community health world as well, because we have some reflection questions that are on this workbook. But I kind of wanted to go over, so this is all information that we kind of discussed in our first session, which is our mission, vision, and core values, as well as our anti-racist organization change initiative. And it also provides you a link of our anti-racist work and resources for you to check out. I don't know if folks remember, but Andres highlighted one of our colleagues, Tracy Bevan's presentation that kind of provides a more detailed information about those anti-racist initiatives that we're doing. So I highly encourage you to check those out on your own time. But these are the things I kind of wanted to highlight with you all. So these are our CCALAC workforce and recruitment resources. So our recruitment resources that we have are our job board that Alex showed us. And again, it's an opportunity for our member clinics to post their open job positions. And it's a way also for the public to kind of view the health center's job openings rather than going to Indeed. So it's like a good job board hub specifically for community health centers that are part of our membership. So I highly encourage you to check that out, as well as we have a resume bank, and it's an opportunity for health centers to view candidates looking to work in community health centers. So potentially there are folks that will be maybe strong candidates for specific job positions that you are looking for. And then we also have the workforce newsletter. So the workforce newsletter, we send it once a month, and it's a great way to kind of know all of the workforce resources available for you that month. And we always highlight different resources every month. There's always something different, and as well as highlight the different programs that we also provide for our health centers to participate. So I highly encourage you to check out our newsletter, as well as subscribe to it and kind of keep yourself engaged. And something that folks can also participate is our roundtables. So we provide a robust amount of roundtables, but the roundtables we're going to highlight is particularly workforce oriented. So we have the human resources roundtable. So these roundtables is an opportunity for health centers to convene and kind of share best practices, as well as share challenges and kind of look for ways to find solutions and discussions to kind of see like what they're doing within their workforce or recruitment strategies. We also, and the contact information there is Alex. So again, all this information, you are highly encouraged to contact any of the staff contacts that are listed. We are pretty responsive and we're here, you know, to support you in your journey. So we also have the Workforce Policy Advisory Group. If that's something you're interested, they meet quarterly and the staff contact is Lily Dorn, who's a legislative affairs specialist. And that work group really deals with a lot of the policy, all the workforce policy information, and as well as advocacy needed in order to improve our workforce recruitment and retention efforts. And then we after the Workforce Policy Advisory Group, we also have the AHEC Advisory Board that happens right after. And again, the staff contact is Alex and it meets quarterly. So it meets right after the Workforce Policy Advisory Group. And the AHEC Advisory Board is a good opportunity to kind of discuss all the workforce programs that can support you with your recruitment and retention efforts. And again, it's a good opportunity to kind of network with other health centers and really kind of learn ways to really build to have more resources and really build a strong workforce pipeline. So those are a few of our resources, and other resources we want to highlight that are workforce resources that are outside CCALAC is the Association of Clinicians for Underserved, which is ACU. So ACU is a great association. They provide a lot of free trainings and webinars and resources. So I highly encourage you to check it out. The link is there. We also have the California Department of Healthcare Access and Information, Loan and Scholarships. So this is a great link for folks to kind of view grants that your clinics are able to participate in, or also for you to even share the staff. Maybe there's a loan repayment program that they can participate in that can help them, you know, pay out loans. So these are great resources for you to check out. We also highlighted CPCA, which is the California Primary Care Association. I believe you have to be a member for that one, but they also provide great resources and provide a lot of resources of what's going on in the statewide with health centers. And another thing that I wanted to highlight is our CCALAC Workforce Resource Toolkit. So this toolkit is a great resource because all the information we have there is always updated, and it also it has literally everything you can think of related to workforce, and I highly encourage you to check it out. There's a table of contents. You could even check out job description samples as well as different loan repayment programs. So I highly encourage you to check out that toolkit. And we also have the National Health Service Corps and Loan Repayment Program highlighted here for folks to kind of see what type of programs they can participate and build that workforce pipeline as well. So those are resources that I just want to highlight and highly encourage you to check out. And again, for any general workforce questions, we highly advise you to email recruitment@ccalac.org. We always check that email and want to make sure that we provide you with the correct information that you seek. And alrighty, so this is the CCALAC workforce programs. So these are the programs that we provide for our members to participate. So just a disclaimer, each program has a different recruits on different times of the year. So they all have a different cycle, but folks are all of our health centers are more than welcome to participate when that cycle opens. So for example, the AHEC Community Health Scholars Program is a 2-year program that we provide for the public in order to really expose the next generation of health professionals. And it's a great opportunity for folks to kind of like learn about community health. And I believe this program, we also need clinics to participate as well. So the staff contact for this program is Andres. And just want to highlight that the program participants are MPH and certain undergrad majors. And I highly encourage you to see the website for the complete list. The benefits for clinics to participate in this program, again, you will have an intern and they can work on a special project. And again, it's an opportunity for the health center to showcase the importance of working in community health for the folks, for a lot of folks who are looking for that work experience within the community health world. And again, it's an opportunity for the health centers to potentially hire the participant at the end of the program. And the only commitment for that program is a signed and completed MOU, assign a preceptor, and host the students for a 250-hour internship. So that's a program that we have, and it's fully funded by the California AHAC. And again, the staff contact is Andres if you have any questions regarding that program. Another program I wanted to highlight is the Allied Health Internship Program. And this program, program participants are allied health professionals. So it's a long list, but a few of them are like medical assistants, LVNs, registered dental assistants or dental assistants, as well as folks who just recently graduated from a four-year university. So this program is fairly new, but the clinic benefits for this program is that clinics who participate in hosting an intern will get a $1,000 incentive, as well as an opportunity again to train the next generation of health professionals, and an opportunity to potentially hire participants after the program. And again, the commitment for the clinics is assigned MOU, assigned preceptors, and hosting the students for a minimum of 100 hours. So this one is more short term. And again, the staff contact is myself. So if you have any questions, feel free to reach out to me. And the website has more information that's not highlighted here. So I highly encourage you to check it out. And, oh, what happened? Oh, I went to the, oops, let me go back. Sorry about that, folks. I clicked the link. Alrighty. Alrighty. So, is there any questions so far? I know there's a lot of information. Not seeing none, but feel free to stop me. Alrighty, so thank you for waiting. So the next program that we have is the AmeriCorps Health Fellows Program. And this program is actually one of the, I believe, the longest programs that we have provided for our health centers. And the program participants are recent college graduates. They're usually pre-med, pre-health students who participate in this program and are looking for an opportunity to work in community health, or are taking a gap year before they start their grad school or medical school. So the benefits for this program is you have a person full-time to be working at your health center for about 10 to 11 months. And again, all these programs are really an opportunity to really train the next generation of health professionals, and really teaching them that there's so much career opportunity within the community health world. And also, many folks from this program potentially get hired at the end after completing the program, or even after they end up going to med school, but then come back to work in community health as well. So we have seen that. So again, these programs are really great pipeline programs for our members to participate. So the commitment for this, again, it's a signed MOU, an assigned supervisor, and match funds. And you can check out the website if you want more information. And the staff contact there is Janet Gonzalez, and that's their contact information. And this program is funded by California Volunteers. And the last, well, not the last program, but the last like pipeline program that we also provide is the FNP Community Care Residency Program. And this program is targets new and recent FNP graduates. So it's a great program as well, because the benefits are that clinics receive a 5,000 incentives for hosting the FNP residency, and they also get a fully licensed licensed FNP. And again, it's an opportunity to train and recruit the next generation of health professionals. So a lot of folks who participate in this program are really just looking for experience and knowledge about community health. So they're more likely to work in community health. So after this program, an opportunity is to really hire the residents after the program completion. And the commitment, it's a 1-year program, and clinics have to sign an MOU, participate in orientation, and get the assigned FNP or MD preceptor. And the website has way more information that's here, but the link is there, and the staff contact is Alex. And the last program we provide, it's not a pipeline program, but it is a learning collaborative for clinics to participate. It's called the Collaborative for Retention, Engagement, and Wellness program. It's a crew program. So this program participants are clinic teams of 3 or 5, and it includes HR, leadership, managers, and frontline staff. So this program, we're actually recruiting for this cycle right now. And the benefits is there's trainings on employee wellness, recruitment, onboarding, stay interviews, and more, and folks get more than and much more. And folks also get 1,500 incentive, coaching from expert effect, and intervention implementation. And the clinic commitment is participating in assessment, the trainings, coaching, and intervention selection. And again, to learn more, I highly encourage you to check out the website, and the staff contact is Andres. And this program is funded by Blue Shield Promise Plan, California AHEC, LA Care, and the California Endowment. So these are programs that are available for your health center. So I highly encourage you to check it out. I know I'm a little bit out of time, but these are the things that I wanted to highlight in the workbook. The rest of the workbook is really just for you to do on your own time, and as well as a community asset mapping activity for you to do to kind of see all the resources that surround your health center. But other than that, is there any questions? Oh, yeah, we have folks that said that they participated in crew. Thank you. All righty, thank you. So I don't see any questions, but again, we are here to support you all. So if you have any questions or comments or concerns, feel free to reach out to us.
Yes, like Crystal mentioned, all of our emails are in the workbook. So please feel free to shoot us an email, either to each of us individually or our general workforce email, which is recruitment@ccalac.org. And we can either answer your question or direct you to the right person at CCALAC.
Mm-hmm. And I also want to highlight that all the information shared, I will be sharing it in the follow-up email along with the recording of today's session. And yeah, so you will receive all this information. Thank you. Awesome, thank you. I think with that being said, I highly encourage folks to please complete the evaluation and let us know how we can improve future trainings. Thank you.